Hello, my name is Zara. I'm going to be your provider for today.
Good night.
We're going to be evaluating your skeletal muscular system on the hips and the knees, okay?
Okay.
Okay, so for the purpose of this video, we're going to have this gentleman with his clothes on, but to provide a better assessment, a gown would be more appropriate to be able to expose proper parts for each part of the assessment. So for the hip assessment, we're going to start off by doing the range of motion. Range of motion consists of active and passive. And we're going to do both, and we're going to compare bilaterally and being very specific, taking a look at the facial grimace and see if there's any limitations on the range of motion. So we're going to start off by doing the external rotation with the leg straight and internal rotation. Do the same for the other one, internal, external. Now we're going to do the internal, same thing, internal and external rotation, but with the knee bent, and this is for the hip. This is external rotation, internal rotation. We're going to do the same for the other leg, internal rotation and external rotation. Now we're going to flex your hips. Please go like this. I'm going to do it myself, and then you do it yourself, okay? So we're going to do the passive. And then do it yourself, please. That one, good. That's flexion of the hips. Now for the extension, we're not able to do it in this because we don't have an exam table, but you would ask the patient to put the leg out and then put it down, but we can't because this limits us, and you would do the same to evaluate the extension of the hip. Now we're going to abduct, same thing with the passive, abduct, and then adduct. And same thing with the other side, we're going to abduct and adduct. Past the midline. And you can ask the patient to do it themselves for active range of motion. Can you abduct? There you go. And then, there you go. Same thing on the other extremity, please. Abduct and adduct. Good. Now we're going to be performing some specialty tests. The first one is the Thomas test. And we're going to be evaluating for hidden contractures. Can you please flex this leg? So what we're going to do, flex it all the way to your abdomen. The more you get, the most you can, please. And then hold it. Okay, so what we would see for any contracture, this would be elevated, this arch would be elevated. In this case, it's normal, and on the back. So you can also test like that. Everything looks okay. We would copy the same for this one. Can we try that one, please? And this once again is called a Thomas test, and this is for any hip flexion contracture. And we see no abnormality. You could rest it now. So now the last one for the hip, it would be the Patrick's or Faber's test, and this one would be for sacroiliac contractures. And what we're going to do, we're going to put your feet like that, and then I'm going to push down, and you let me know if you have any pain or if we see any limitness on the sacroiliac, for any sacroiliac disease. Let me know if you have any pain or anything. Okay, we'll push it down. Now we're going to do the same. Any pain?
No.
All right, now we're going to do the same. And this exam table limits us because of these bars, but this is the best we could do for this purpose. So we're going to push it down. Do you have any pain?
No.
No? Okay, great. So this basically concludes the hip portion. Now we're going to move on to the knees. And we're going to start off by inspecting the knees. We're going to inspect them to see if there's any knock knees, any bow knees. Look at the popliteal fascia, if we're able to do so, to see if there's any Baker's cyst, to see a suprapubic pouch area, if there's any obvious bulging, to see if there's any atrophy on the quadriceps, any obvious deformities, any redness, swelling, or any of that nature. Then we're going to proceed on to what's called a bulge sign. So what we do with the bulge sign, and same thing we do for every area, we basically milk where the suprapubic pouch area is, milk it in. This is to evaluate to see if there's any effusion, and then we're gonna push medially and then let it go, and then we would feel or see if there's any bulging, and you would be assessing for any effusions or any liquid in this area. Same thing, suprapubic area. Basically, milk it down, push it medially, and then you're gonna see if there any bulging sign on that knee for any knee effusions. Now we're gonna palpate the suprapubic pouch area. Same thing for any effusion. Obviously, effusion, the popliteal area on the sides of it, the popliteal tibial area. Let me know. Do you have any pain or anything?
No.
No. So no pain. There's no obvious lesions, no bulging, no effusions. Now we're gonna do the range of motion of the hip. So he's already extended. This is already extended. Now we're gonna flex it. To flex it, we're gonna just go like this, flex. This is passive. Passive, can you do that yourself, please? Right, and then left. So these are the range of motion for the knee. Now we're gonna do what's called the valgus and varus stress test. And what these do is to see if there's any MCL or LCL tears. So what we're gonna do, and this is for the valgus, is we're gonna push pressure this way and get pressure on this way. Do you have any pain?
No.
And this is for the LCL and MCL tear. We're gonna do the same for this. Then we're gonna push it inward and this one outward. And this is for the MCL tear. Now now we're gonna do what's called the varus stress test, and this is the other side. We're gonna push this and then pull this in. Do you have any pain?
No.
No. And this is for the LCL tear, or LCL. So it was this way. So push this in, this one out. Any pain?
No.
No. And that was the varus. We did both the valgus and the varus stress test for LCL and MCL tear. Now we're going to move on to more specialty tests. The first one is going to be the drawers test. And this one, I'm going to ask this patient to flex the knee. This is for ACL tears. Flex the knee. Now we're going to sit on top of the patient's foot, or in this case, due to the exam table we have, I'm just going to put my knee. And then let me know if you have any pain, okay?
Okay.
And we're going to pull it towards me. We're going to pull. The femur is already stabilized, and now we're going to pull by the calf area, and pull it towards me, and then push it inside and assess if there's any give or any pain. And we're going to do the same. Did you have it? Was there any pain there?
Nope.
Now we're going to do the same, and this is for ACL or ACL tear or PCL tear posterior. And we're going to do the same. Pull it.
No.
Push it. Any pain?
Nope.
No? Okay, good. So now we're going to move on to the Latchman's test. For the Latchman's test, it's basically testing the same ACL tears. But for this one, we're going to stabilize the extremity ourselves. We're going to stabilize the femur, and then this area, and then we're gonna. Do you have any pain?
No.
No. Same thing. Now we're gonna do the other side. This is Latchman test for ACL tears. We're gonna stabilize the femur, and then. Do you have any pain?
No.
Okay. Good. That was the Latchman, and the last one for the knee is the McMurray's test, and this is for a meniscus tears. So what we do is we internally rotate, and then we're going to go down. Let me know if you have any pain, okay?
No.
Do you have any pain? Now we could do externally rotate by the knee area and then go slightly down. Do you have any pain?
No.
No. And we're going to do the same for the other extremity. Grab them by the heel. Flex it a little bit, internally rotate, and then go down. Any pain?
No.
No. And externally, and then go down.
No.
Any pain? This was for meniscus tears. And this concludes the skeletal muscular of the hip, knee areas.